I just left my clinic, but I just had to make this video. After being in my clinical practice for over 29 years, there's one thing that has completely shocked me. And no, it's not that some patients think diet soda cancels out their burger and fries. It's not even the fact that oatmeal can spike blood sugar higher than a Snickers bar. No, the biggest shock of my career. Most of my patients, yes, most, don't actually want to take medicines, period. And in spite of what you may believe, that includes those fancy weight loss meds that everybody seems to be interested in using. But here's the real kicker. Most doctors don't know what to do with that. Doctors are trained to pull the medicine trigger first. Ask questions later is how we were taught. But is that really the best way? Today we're diving into the real reason why so many people are hesitant to take medications, why doctors aren't offering better alternatives, and the research-backed natural healing tools that have been right under our noses but massively underutilized. Stick around. This is going to change the way you see medicine. But before I begin, tell me why you are not excited about taking medicine, or any medicine-related horror stories you'd like to share. Now let's get into it. Why are people so hesitant to take medication, even when doctors tell them they need them? I mean, isn't modern medicine supposed to be saving lives? Well, let me introduce you to my patient, Lisa. Lisa comes to my office and says, so doc, I know my blood pressure is a little high, but I really don't want to start medication. Can we try something else? I say, Lisa, I get it. A lot of my patients feel the same way. What's your biggest concern? Lisa says, honestly, once I start, I feel like I'll have to take it forever. And I heard some of these meds can cause kidney issues, dizziness, and a list of other effects. I just don't want to depend on pills. I say, that's a fair concern. Many medications don't actually fix the problem. They just manage symptoms. So Lisa, what if I told you you could actually try lifestyle approaches first? Lisa says, that's exactly what I've been hoping you'd say. Lisa is not alone. I've had this conversation hundreds of times. People are worried about side effects. They're worried about long-term consequences. They're worried that once they start, they'll never be able to stop. And honestly, those are valid concerns. And more examples include side effects that create new health problems. For example, did you know that metformin can cause a B12 deficiency? Other concerns include that medications can lead to dependency on medications for life. That's great for drug companies, but not so great for you. Many meds come with high costs, especially for chronic conditions. But the most important issue about medication is that many are treating symptoms instead of fixing the root causes. So why aren't doctors offering better alternatives? Well, that brings me to another shocking truth. I'm going to let you in on a secret most doctors won't tell you. We weren't trained to think about food as medicine. We weren't taught that the most powerful healing tool isn't a drug. Instead, it's the very thing that you put on your plate. In medical school, we get on average less than 20 hours of nutrition training. And that training is outdated, government-approved guidelines that tell us to push grains, fear fat, and think calories in, calories out is what matters. So what happened? We get doctors who don't have experience with diet-based treatments, don't know the science behind it, and don't have the confidence to prescribe it. So when a patient comes in struggling with high blood pressure, diabetes, obesity, autoimmune issues, what's the first thing we do? We reach for the prescription pad. Why? Because it's easy. It's what we know. And trust me, I get it. I used to be that doctor. But when I started looking at the research, guess what I found? The best healing tool on the planet, the one backed by decades of research, isn't some new drug. It's a ketogenic diet. Here's the crazy part. Keto wasn't even invented for weight loss. It was originally used to treat epilepsy because it helped regulate brain function. And then over time, we realized, wait a minute, this diet reverses insulin resistance, stabilizes blood sugar, and heals metabolic disorders. But instead of making it the gold standard for chronic disease treatment, it got buried under food industry propaganda and big pharma influence. Lisa asks, so if food and lifestyle work so well, why aren't more doctors recommending it? I say, because it's easier to write a prescription than to educate someone on lifestyle change. Lisa says, but isn't that kind of backwards? I say, Exactly. We need a new model, one where patients are given the opportunity to heal with natural modalities first. Imagine a system where instead of being told, here, take this for the rest of your life, you're given the tools to reverse the disease itself. Most people are aware of the two models of how healthcare can be delivered. We have the medication-based model, where we prescribe drugs first, manage symptoms, ignore root cause, and the lifestyle first model, where we focus on fixing the diet, healing metabolism, using meds only if necessary. The truth is, most doctors aren't going to change unless patients demand it. So if this video resonated with you, it's time to take action. Number 1, educate yourself. Learn about real food, insulin resistance, and the power of nutrition. Number 2, ask better questions. Next time you see your doctor, ask about non-prescription options. Number 3, join the movement. You can do this by supporting 2 organizations I am proud to be part of. One is the American Diabetes Society, which prioritizes food as medicine as the first option for persons with diabetes. The second is the metabolicrevolution.org, where we focus on removing processed food from the diets of our children, making sure the USDA guidelines are evidence-based, and making sure the FDA is not biased by industry. Number 4, share this video, subscribe, and spread the word about natural healing. Together, we can change the system. One patient, one doctor, one meal at a time. I thank you for coming to my channel, and I'll see you in the next video.